Hello, my name is Abby. I'll be your nurse practitioner today. What's your name?
I'm Carrie.
Carrie, nice to meet you. Can you tell me your date of birth?
December 17th, 1993.
Okay, so that makes you how old?
25.
Okay, do I have permission to record you for my class?
Absolutely.
Okay, thank you. So tell me what brings you in today, Mr. Duggar.
I've had a headache and a sore throat, been coughing a little bit, and have been getting chills.
Okay, you felt the chills all over your body?
Yes.
Or okay. Let's see. How severe are your symptoms? Would you rate them? On your activities of daily living, have you been able to
It's keeping me from wanting to go to work.
Okay. So that's how severe it is. How long ago did this start?
I would say within the last week.
Within the last week, okay. Are these symptoms happening all the time or just sometimes?
It's worse in the morning.
Worse in the morning. Have they been constant or?
Yes.
They have, okay. Let's see, you said they started about a week ago. Have you tried anything to relieve your symptoms?
Yeah, I've been taking some ibuprofen.
Okay.
And been taking, oh gosh, I can't remember what it's called. I think it's called Mucinex.
Yes, okay. Have those been helping?
Temporarily.
Okay. Have you tried any other things to help besides medication?
No.
Okay.
Well, I've been taking hot showers as well.
Okay, that probably helps a little bit
Yeah.
too. Is there anything that makes it worse?
No.
Okay. Let's see. Is there anything that you think that you've been exposed to?
Well, a partner at my work had a kid who had the flu, and she felt like she got it as well. So she was worried that she may be passing it to people at work too.
Okay, so potentially the flu.
May have been
around
exposed.
that. Okay. And did you mention that you had a fever?
Yes.
Okay. Do you remember how high it was?
It was like 102,
Okay.
somewhere around there.
Okay. Have you had a fever recently?
Yes.
Okay. Like in the last 24 hours?
Yes, absolutely.
Okay. I just need to ask you a few basic questions just about your history to make sure that I'm getting the whole picture, okay?
Okay.
Are you taking any medication, Mr. Duggar?
No.
No prescription medications? Nothing over the counter besides the Tylenol or ibuprofen and Mucinex?
No.
Okay, do you remember what the dose is that you're taking?
I mean, ibuprofen might have been like 500
Okay.
milligrams.
All right. If you have the bottles with you, then we can look at those in a little bit.
Sounds just perfect.
Okay. Let's see. Have you had any prior surgeries?
No.
Okay. Have you ever been hospitalized?
Negative.
Okay. Do you have any previous illnesses?
I was diagnosed with irritable bowel syndrome.
Okay.
And then I also had a virus in my colon at one point.
Okay.
But-
Did you take any medications for those?
Not really.
Not really. Do
Mm-mm.
you feel like they just resolved on their own?
Yes.
Okay. Are you allergic to anything?
Nope.
Okay. Are you up to date on your immunizations?
Yes.
Okay. Did you get your flu shot this year?
I got it like 2 weeks ago.
Like
so.
2 weeks ago, right before or right after you felt your symptoms come on?
Before.
You got it before your symptoms?
Before.
Okay. And I will let you know that it does take about 2 weeks for your body to build up antibodies against the flu vaccine, so it's not uncommon to still catch the flu within those first 2 weeks for sure. So,
Okay.
since you're totally not protected yet. Okay, so let's talk about your family. Do you have any medical history in your family that I should be aware of?
Well, my mom's dad passed from congestive heart failure.
Okay.
My dad has had depression in the past. My dad's mom has had breast cancer in the past.
Okay.
And my mom has excessive heartbeats
Okay.
in stages. SVTs maybe
Yes,
is what it's
that
called.
sounds about right. Okay.
And then I think my dad's dad has had something too. I just can't remember.
Okay.
Something heart related maybe.
Okay, so there's a little bit of cardiac problems in your family. Is there any high blood pressure in your family?
Not that I'm aware of.
Okay. Let's see what else. So I need to ask a little bit about your social history. Are you married?
Absolutely.
Yes.
Mhm.
Is it your first marriage?
Yes.
Okay. Do you have any kids?
No.
Okay.
Just a dog.
Okay. Are you currently employed?
Yes.
Okay. Are you in your work? Are you exposed to any toxins that I should be aware of?
No.
Okay.
I'm in an office.
Okay. Do you take illicit drugs?
Nope.
Do you drink alcohol?
Yes.
Okay. How much alcohol would you say you drink per week?
Per week, probably 6 to 10 drinks.
6 to 10 drinks per week. Okay. Do you feel like you drink those all at once, or are they fairly spread out?
It's a drink or two a day.
A drink or two a day. Okay. Do you use tobacco products?
Nope.
Okay. You don't vape, cigarettes,
No.
cigars,
Yeah.
chewing tobacco.
No.
None of that. Okay.
Mm-mm.
Sexual history. You mentioned that you're married. Has that been your only partner?
Yes.
No known sexually transmitted illnesses that you're aware
I
of?
hope not.
Okay. And then let's see, your education level. What's your highest education level?
Got a master's.
Your master's. Okay, very nice. Congratulations.
Thank you. Thank you.
Okay, let me think what else. I think that's most of the reviews that I need to do. I would like to go ahead and assess you on some of those things that we talked about. So I'll go ahead, washing my hands. I want to take your vital signs. So I would get his temperature, his heart rate, his blood pressure, his respiratory rate, and his oxygenation status. I'd like to weigh him and get his height so I can identify his BMI. And that will be my general assessment to get an idea of what he looks like. So I will start with assessing your head. Would you mind taking your hat off for me? I want the camera to be able to see you.
I look
Okay.
good. I know.
I'm going to go ahead and palpate your head. I'm going to inspect for any abnormalities or asymmetry. I'm going to go ahead and palpate.
Please
Hair
do.
is full and thick.
Thanks.
There's no lumps or tenderness that I feel. Is that true?
It's true.
You agree? Okay.
Absolutely.
I'm going to go ahead. I'd like to assess your lymph nodes, okay? So you have 2 back here, your occipital, your postauricular, your preauricular, your submandibular, submental, anterior neck, posterior neck. Would you please shrug your shoulders for me like this? Okay. And supraclavicular. Okay. Did you have any tenderness there? Okay, there is no tenderness or palpable lymph nodes. Let's see. I'm going to come stand behind you. I need you to look at the camera.
I'm so
going to
sorry.
put my fingers right here, and I need you to swallow. Okay. Would you tilt your head to the left? Swallow. Tilt your head to the right. Swallow. Okay. No palpable thyroid.
Thank goodness.
Yes. Okay, I'd like to go ahead and assess your eyes.
Please do.
Okay. So I'm going to go ahead and look at your pupil size. If you'll just look straight ahead at me. Pupils are 6. I'm going to assess the reactivity. So I'm going to shine my light in your eye. Just look at my finger. Okay, I'll do the other one. Okay. Pupils are a size 6, equal round, reactive, and brisk. Let's see, what else? I'm going to have you follow my finger. Keep your head still. Just follow with your eyes. Testing the cardinal visions of gaze. Ocular muscles seem to be intact. Okay, I'm going to go ahead and, I've already looked at your eyes, so I'm going to go ahead and test your ears, okay?
Okay.
Just keep looking straight ahead.
Okay.
Ears are intact, pink. The ear canal is clear. I see a gray, pearly eardrum. There's no lesions, drainage, tenderness, or redness. I'm going to come assess that other ear now. Okay. I see a gray, pearly eardrum. There's no drainage, tenderness, lesions. The skin is pink and intact. Okay, I'm going to have you go ahead and just sit right here. I'm going to look up your nose. Okay. There's a lot of hair in there.
Thanks.
There's clear yellow drainage in the nostrils. The sinuses do seem to be slightly reddened and inflamed, but the nose is intact.
And hairy.
Okay, would you please open your mouth for me and say ah?
Ah.
Ah, and you see your throat? Okay, I see no lesions on the tonsils. The oral mucosa is pink. It is moist. It is intact. There is some redness and swelling of the throat. Okay. So let's see. I'm going to go ahead and assess your lung sounds, okay? So if you'll
Thank
just
you.
kind of breathe normally for me, I'll assess with the diaphragm of my stethoscope. Good, just breathe normally. Okay, I'll be assessing the back of your lungs. Lungs are clear to auscultation. I'm going to go ahead and palpate to make sure there's no hyperresonance or dullness in the bases of your lungs. Lungs are dull. There is no hyperresonance in there. Then let's see. So I'm going to ask you some genitourinary questions. Just so we don't have to do the assessment on screen, I would go ahead and assess that there's no redness or inflammation, that the testes are distended. I would assess to see if the skin is pink and intact and if we are circumcised or not. Let me think. Okay, Mr. Duggar, so we're going to go ahead and we'll do a rapid flu test on you. It's not totally accurate, but that's pretty much looking like what you have. So you've missed the 48-hour mark to be able to get one of the flu medications, but to be honest, that really only knocks off about a day of the illness. What's going to be important for you is going to be rest, hydration, keep taking your steamy showers to loosen your secretions, continue with your Tylenol and ibuprofen to control your fevers. Let me think what else. So we'll let you know before you leave here if you do have the flu, and we'll just give you some time to rest, and should be better in about 5 to 7 days. Do you have any questions for me?
Nope.
All right, thank you so much.
Thanks, Angel.